34-year-old female presents to our outpatient clinic. She suffered a hemorrhagic stroke 1 month ago and has since been having residual right-sided weakness and sensory impairments affecting her postural control. She has good static standing balance and ambulates independently short distances with the use of a wheeled walker and an AFO. Her main complaints are difficulty with activities such as lifting, carrying objects, and reaching for objects, standing on uneven surfaces. Her husband reports that she has experienced multiple falls at home. To address our patient's balance deficits, we are going to do treatment using portions of the Berg Balance Scale. According to the Tilson et al. Article, the Berg Balance Scale has been the most sensitive for predicting fall risks in patients post-stroke. Due to the results of the LEAP study as well, we will not be emphasizing locomotor training at this time because our patient is only 1 month post-stroke. The LEAP study emphasizes that intensive locomotor training should not be started until 6 months post-stroke. Okay, so I'm going to show you what I want you to do first. So you're just going to sit there, I'm going to show you, and then we'll have you do it, okay? So I'm going to have you stand up. You can use the walker to walk with. You're going to walk all the way to this blue dustpan. I want you to bend down, pick it up. I'm going to be behind you. You're going to give it to me. You're going to keep walking, turning around till we get to this sponge. Again, I want you to bend down, turn around the other side, give this to me, and just keep on walking. Turn around and sit down. And that's it. Okay?
Okay.
All right, stand on up. We're going to walk all the way to the blue dustpan first.
Taking it hard on me.
Nicely done. There you go. And sit down. During this exercise, I was purposefully not giving gait cues because we are not gait training at this time because of the LEAP study. This exercise incorporated multiple different activities from the Berg Balance Scale, including sitting unsupported, sit to stands, reaching objects from the ground, as well as turning around over each opposite shoulder. Next, I'm going to show you some exercises that you can do at home with your husband. Since you have been having some falls at home, it's really important to make sure your environment is safe while you're doing these because we don't want you to have any problems doing these at home without me around. So when I'm going to show you how to do some squats safely at home, I want you to be standing in front of your couch. I want you to have the walker in front of you, and I always want your husband to be there on your right side. Okay? He's here with us today, so I'm going to be showing him how he should be spotting you as well at home to make sure that you don't fall.
Okay.
All right, so first, before you squat, you tend to have all your weight on your left side, your strong side. So before you squat, I want you to shift your weight over to the right and try and get your weight even on both feet. Do you feel the difference between how you were standing before and how you're standing now? Okay.
Just feels a little funny, but
We got to strengthen that right leg. So this walker is just here to make sure you don't fall. I don't want you to be using this for strength. I don't want your arms to be doing the work. I want your legs to, okay? All right, so all you're gonna do is you're gonna squat down a little bit and come back up. I don't want you sitting down on the couch and then standing up, okay?
okay.
Let's try that out. Try not to touch the couch like that. So you're squatting down a little bit and coming right back up. Good job. And your husband is also going to remind you, if you start to shift your weight to the left, I want you to bring your weight equally onto the right foot. Any questions with that? Okay, so this last home exercise program that you're going to be doing with your husband at home is going to be in the kitchen. Do you have a countertop like this and some shelving up top?
Yeah, I have some open shelves that
Okay.
we keep our cups.
Perfect. So I want you to put a dining room chair or a kitchen chair behind you, preferably definitely one without wheels on it, so just that it won't roll back on you.
Okay.
I want the walker to be in front of you still, and I still want your husband here beside you, kind of behind you and on your right side. What you're gonna do is I want you to use this right arm to try and strengthen this up as well. I want you to make sure you're even with your weight on your left and right foot. And then you're just gonna reach up to the shelf and grab the cup and put it down on the counter. And then you're gonna reach forward for a cup and break and put it, stack it, and then you're gonna reach to the side and put it in. So I want you doing this breakfast, lunch, and dinner. Every time you need a drink, I want you to be doing this a couple times. Maybe do 10 reps of reaching for the cups. I want you to be reaching a little bit further than you're comfortable doing, okay? The more practice you get with balance activities, studies have shown that the better your balance will get. So the more you can do, the better.